Most people leave their doctor's office with an HbA1c result and almost no idea what they have just been told. They have been told whether they are diabetic or not. That binary framing, diabetic or fine, is one of the most dangerous blind spots in modern medicine, because HbA1c is not measuring whether you have diabetes right now. It is measuring how much biochemical damage has been quietly accumulating in your blood for the past 3 months. And it is doing this regardless of whether you have crossed any diagnostic threshold. My name is Dr. Victor Hayes. Let me explain what this number is actually telling you, because understanding it properly changes how you think about your metabolic health, your aging trajectory, and the choices you make every day. Here is the mechanism. Inside your red blood cells is a protein called hemoglobin, which carries oxygen around your body. When glucose circulates through your bloodstream, some of it spontaneously binds to that hemoglobin. No enzyme required. It just happens. And the higher your average blood glucose, the more sugar molecules attach. That attachment is permanent for the lifespan of the red blood cell, which is roughly 8 to 12 weeks. Your HbA1c result is therefore a weighted average of your blood glucose exposure across the previous 2 to 3 months. Not the spike you had after breakfast yesterday. Not what your glucose is doing right now. The total biochemical glucose exposure your tissues have been soaking in, day after day, meal after meal, across months. The reason this distinction matters enormously, damage at the cellular level, is not about single spikes. It is about cumulative exposure. You can have a perfectly normal fasting glucose reading and still be slowly glycating proteins throughout your entire body if your post-meal glucose stays elevated for hours every day. Millions of people leave medical appointments feeling reassured because they have been told they are not diabetic, while silent damage is already in progress. Your cells do not care about diagnostic cutoffs. Your blood vessels do not care about diagnostic cutoffs. Your brain does not care about diagnostic cutoffs. They care about the chemical environment they are living in right now. Why is glucose attachment so damaging? The binding process, glycation, fundamentally alters the structure and function of the proteins it attaches to. And this is not a phenomenon that only occurs in advanced diabetes. It is a basic chemical reaction happening in everyone's body all the time. The variable is how fast. Glycation does not stop at hemoglobin. Glucose is binding to proteins throughout your body, in your blood vessels, in your kidneys, in your eyes, in your nerves, in your brain. Once a protein becomes glycated, it loses flexibility. Blood vessels that should expand and contract smoothly become stiffer. Enzymes that should perform precise biochemical tasks begin to malfunction. Structural proteins that support tissue integrity gradually break down. The damage compounds further because glycated proteins trigger oxidative stress, creating reactive molecules that damage your DNA, cell membranes, and mitochondria. Your immune system recognizes glycated proteins as abnormal and mounts an inflammatory response. This adds chronic low-grade systemic inflammation as a second layer of harm. Meanwhile, stiffened blood vessels deliver oxygen less efficiently, meaning your brain, heart, muscles, and organs all operate in a subtly oxygen-compromised state, never quite receiving optimal delivery. This is how glycation accelerates biological aging at the cellular level. Not just visibly, though skin collagen glycation absolutely drives wrinkles and loss of elasticity. At the level of every organ system in your body, your arteries become less compliant, raising blood pressure and forcing your heart to work harder. Your brain's insulin signaling becomes impaired, affecting memory and cognitive processing speed. Your kidneys' filtration membranes stiffen. Your nerves lose protective coating. The cruel irony is that people assume sugar damage only matters after crossing into diabetic territory. Biochemistry does not work that way. Glycation is happening right now, in proportion to your average glucose exposure, whether you have been diagnosed with anything or not. What do different HbA1c numbers actually mean for your future? Medical guidelines define results below 42 mol/mol as normal, 42 to 47 as prediabetic, and 48 or above as diabetic. In American units, below 5.7% is normal, 5.7 to 6.4 is prediabetic, 6.5 and above is diabetic. Clinically useful for diagnosis, but these cutoffs hide an enormous range of biological risk. Someone with an HbA1c of 35 and someone with an HbA1c of 41 are both stamped as normal, yet their long-term health trajectories can be dramatically different. Every single point increase in HbA1c, even within the so-called normal range, corresponds to a measurable increase in cardiovascular risk. That relationship does not switch on when you cross the diabetic threshold. It is a smooth, continuous gradient starting well below any diagnostic cutoff. The same pattern holds for dementia risk. People with HbA1c in the mid to high normal range show accelerated cognitive decline compared to those at the lower end. Normal is not the same as optimal. Optimal HbA1c for longevity sits in the low 30s, where glycation is minimal, insulin sensitivity is high, and metabolic flexibility is preserved. Mid-30s to low 40s represents acceptable but rising risk. Anything approaching the pre-diabetic range reflects metabolic dysfunction already well established, regardless of what label has been applied. Why does HbA1c drift upward so readily in modern life? Ultra-processed carbohydrates, bread, pasta, cereals, pastries, crackers, break down into glucose so rapidly that the pancreas must release large amounts of insulin to manage the result. When this happens multiple times daily, every day, cells gradually become less responsive to insulin. They require progressively more insulin to achieve the same glucose clearance. That insulin resistance is what drives HbA1c upward over years. Liquid sugar is even more damaging. Fruit juices, soft drinks, sweetened coffee, smoothies loaded with fruit, all deliver concentrated glucose into the bloodstream without the fiber, protein, or fat that would normally slow absorption. The liver is overwhelmed processing the fructose component and begins converting excess into fat, becoming insulin resistant in the process. Sleep disruption amplifies everything. When sleep is inadequate, cortisol and adrenaline rise, both of which elevate blood glucose. Simultaneously, sleep deprivation increases appetite hormones and drives cravings for exactly the high-sugar, high-carbohydrate foods that worsen the cycle. A single night of poor sleep can reduce insulin sensitivity by up to 30%. Chronic sleep restriction sustained over months and years produces proportionally compounding metabolic harm. Chronic stress works through the same hormonal pathway. Cortisol mobilizes glucose into the bloodstream to fuel a fight-or-flight response. Useful when stress meant physical danger, actively harmful when stress is psychological and persistent. Loss of muscle mass makes everything worse. Muscle is your body's primary glucose disposal site. More muscle means more storage capacity and more active glucose burning. As muscle mass declines, which happens progressively after your mid-30s without deliberate resistance training, glucose stays in the bloodstream longer after every meal. The result is that HbA1c creeps upward in many people through their 30s and 40s without any clear signal that something is wrong, until fatigue, cognitive fog, and difficulty managing weight accumulate into a pattern they can no longer attribute to stress or aging. When HbA1c rises, the damage extends far beyond glucose metabolism. Your brain is particularly vulnerable. Elevated HbA1c means chronic erratic glucose supply and progressive insulin resistance in the brain, impairing the neural circuits underlying memory formation and cognitive processing. People with higher HbA1c, even below the diabetic threshold, show faster cognitive decline and higher dementia risk. Some researchers now describe Alzheimer's disease as involving a form of brain-specific insulin resistance, given how profoundly insulin signaling in neurons is disrupted in affected individuals. The metabolic connection to cognitive aging is not subtle. It is one of the most important and underappreciated links in preventive medicine. Your cardiovascular system deteriorates through glycation-driven arterial stiffness. Stiffer arteries raise blood pressure, force the heart to work harder, and damage the endothelial lining where atherosclerotic plaques begin to form. Higher HbA1c promotes oxidative stress and inflammation, both of which accelerate plaque formation and increase the risk of those plaques rupturing to cause a heart attack or stroke. Your kidneys are extremely sensitive to glycation. Tiny blood vessels in the filtration membranes stiffen and leak. Protein spills into the urine. Kidney function progressively declines. This process begins long before clinical kidney disease is diagnosed. The trajectory starts years earlier, during the period when every HbA1c result is still technically normal. Can HbA1c be meaningfully changed? Yes, but understand the timeline. HbA1c is an averaging process. Red blood cells turn over in approximately 8 to 12 weeks. Changes you make today will not be fully reflected in your HbA1c for another 2 to 3 months. What moves it is not intensity. It is sustained behavioral change over weeks and months. Eating in a way that keeps post-meal glucose lower day after day. Moving your body consistently enough to improve insulin sensitivity. Sleeping adequately to keep stress hormones regulated. That consistency is what shifts the 3-month average downward. The most powerful interventions. Build and maintain muscle mass through resistance training. Muscle is the primary glucose disposal site, and more of it means a permanently lower average glucose exposure. Walk after meals consistently. 15 minutes after each main meal can reduce post-meal glucose spikes substantially, and daily repetition compounds into meaningful HbA1c reduction. Protect sleep. 7 to 8 hours of quality sleep per night is a metabolic necessity, not a lifestyle preference. Structure meals with protein and fiber before carbohydrates. This slows gastric emptying and moderates glucose absorption at every meal. Eliminate liquid sugar. Fruit juices, sweetened drinks, and sugary coffee products represent one of the fastest-acting and most reversible drivers of elevated HbA1c for most people. A brief note on supplements. Magnesium is involved in over 300 enzymatic reactions, including insulin signaling, and deficiency is genuinely common. 300 to 400 milligrams of magnesium glycinate or citrate daily is reasonable and well tolerated. Berberine has reasonably solid research supporting improvements in insulin sensitivity and modest HbA1c reduction of around 0.5% when taken consistently alongside lifestyle changes. Neither supplement replaces the behavioral fundamentals, they support them. One practical note about testing frequency. If you are actively working to improve your HbA1c, testing every 3 months aligns with red blood cell turnover and gives you genuine feedback on whether your changes are working. If your HbA1c is already in the low normal range with healthy lifestyle habits in place, annual testing is generally sufficient. Let me close with the reframe that I think matters most. HbA1c is not a diabetes test. It is a biological aging speedometer. It tells you how fast your cells, tissues, and organs are accumulating damage relative to your chronological age. It reflects your vascular aging, your cognitive aging, your immune function, and your metabolic resilience, all in one number. And unlike many biological processes that progress independently of your choices, this one responds directly to how you live. Build muscle, protect sleep, reduce ultra-processed carbohydrates, manage stress, move your body consistently. Your HbA1c will improve. That improvement is not just a number changing on a blood test. It is your biological aging slowing down. Your HbA1c records the story your daily life is writing into your biochemistry. The question is what story you want it to tell. If this was useful, please subscribe to this channel and share it with someone who needs to hear it. I will see you in the next video.